Good evening and welcome to this special edition of Cronkite News. I'm Sydney Glenn. Thanks for joining us. Tonight, a look back at our Emmy Award-winning investigative coverage of the heroin crisis here in Arizona and the impact our stories have had on addicts, families, law enforcement, and policymakers.
This year, Cronkite News made a major commitment to expose the hidden dangers of heroin use in communities across our state. This documentary project is called Hooked, tracking heroin's hold on Arizona. It struck a chord with law enforcement, counseling programs, and worried parents with its state debut just 2 weeks ago.
If you have 20% of an entire generation of young Americans who are addicted to heroin in 10 years, what does that do to our country? What does that do to the future of our country? The future leaders? What's that get? We're going to wipe out an entire class of people that at some point are going to lead this country. We got to get it under control, and we got to do it fast.
We're now tracking the effect of this call to action in an effort to raise awareness and reduce the abuse of this devastating drug. We have team coverage from our reporters here in Arizona and in Washington, tracking the documentary's impact. First, we'll go to Lauren Hanley, who has followed the story here in Arizona. Lauren?
During and following the airing of the documentary, a phone bank was set up and answered over 600 calls from both families and addicts themselves who were seeking help and looking for a way to fight this deadly epidemic.
What we're talking about is trying to save an entire generation of people here. And if we can't get past that as adults and leaders in this country and as parents, if we can't get past that, then we're gonna have problems.
Across the state, families, addicts, police, and drug counselors are struggling to break heroin's hold on Arizona.
It's a deadly addiction. It's the intensity and the acuity of it is so high that there's no such thing as a social heroin user. So the intervention needs to happen immediately.
On average, a child can be struggling with substance abuse for 2 years before their parents find out. By the time you're using substances, abusing substances for 2 years, you're no longer a casual user.
The Cronkite News special report found more young adults in their early 20s have overdosed on heroin than any other age group since 2009.
You're getting into the demographic now of those people, or those, the kids rather, they're still kids. Those kids looking to possibly maliciously abuse those substances, and they may know that their parents use them for whatever ailment their parent may have, and they're not going to notice a pill or 2 or 3.
And it can all start, experts tell us, with prescription painkillers.
People have always been concerned about the fact that prescription drug abuse can and sometimes does lead to heroin abuse and, of course, heroin overdose deaths.
Most of the addicts we interviewed said they started using heroin because it became too expensive to get pain pills, and heroin was cheaper and easier to get.
When I first started, it was like $15 a pill, and so if you have enough money to get high, it would cost me like $120.
Once addicts are hooked, the most important next step is to get them into treatment.
What we're doing in the criminal justice system is looking for opportunities when we have heroin users who come into our system, looking for opportunities to get them directly from jail into treatment.
Dara and her husband Braden are both recovering addicts who got help at Calvary Addiction Recovery Center.
The world comes crashing down and you realize what you've done, who you've harmed, and you just have to go off of that. I mean, that's the starting point, take that and run.
Dara and her husband Braden are both recovering addicts who got help at Calvary Addiction Recovery Center.
We did know that there was some drug use going on. We've never heard the word heroin. I remember very clearly the first day that I heard that's what we were dealing with.
Don't ignore it. Don't hope that it'll go away on its own, because it won't. Addiction's powerful.
And watch for the significant signs of heroin use. Syringes, cotton swabs, spoons, small baggies, pipes, rubber ties, and foil. Look for track marks, pinpoint-sized pupils, slurred speech, significant weight loss, and scabbed or bruised skin. Users may also steal money, sell personal items, and use up savings. By seeking out help and following through with treatment, young people like Anna, who once struggled with addiction, still have hope.
Still have the opportunity to have a complete life and have a career and a family and all of these things that I thought were totally impossible.
The Arizona Department of Health Services does have a drug monitoring program, so a doctor can check a patient's history and therefore see if they need to or not need to prescribe medication. Live in the First Amendment Forum, Lauren Hanley, Cronkite News.
Thank you, Lauren. Now let's send it over to Liliana Salgado in our Washington Bureau, who spoke with Arizona leaders visiting our nation's capital. Liliana?
Well, in Washington, there's growing discussion about the heroin problem in Arizona and nationwide, and Arizona leaders were here to talk about the issue.
In recent years, the non-medical use of prescription drugs has represented our nation's fastest growing drug problem.
And at the U.S. Conference of Mayors, leaders examined the latest data from Substance Abuse and Mental Health Services Administration.
Our law enforcement, Phoenix Police Department, is very, very tuned to this issue. And I know they're working incredibly hard to make sure that they are fighting it as strongly as they need to be.
The approach that I think you see happening in Mesa and more in other communities is to address the problem as a health issue as much or more than it is a criminal issue.
While health care for addicts is important, Pinal County Sheriff Paul Babu reminded lawmakers support for law enforcement is necessary to stop the dealers and drug traffickers.
A majority of them are coming through our county. So whatever we do or don't do about this is going to have a huge impact, not necessarily upon the people of my county, but the rest of the country.
Whether treatment or law enforcement, or ultimately a combination of both, the consensus here in Washington is that mayors need to take the lead to fix the heroin crisis. Live in Washington, D.C., Liliana Salgado, Cronkite News.
As part of Cronkite News' dedication to tracking heroin's hold on Arizona, reporter Lauren Hanley went to Payson, Arizona, where the problem with heroin continues to grow. Lauren?
The small town of Payson sits in the heart of Arizona's rim country, almost 85 miles away from metropolitan Phoenix. But officials in Payson tell us heroin use is just as destructive in rural communities as it is in large urban cities.
We'd had some issues with other drug problems in the past, but this is just encompassing our whole community.
Earlier this month, nearly 70 people squeezed into Payson Town Hall, some standing in the hallway, for a 3-hour meeting on the growing heroin problem in their community.
And what came from that meeting was a sense of desperation. These families are looking for help any way they can get it. A few of the addicts were as well.
Despite being a rural town of just 16,000 people, the average user in Payson is the same as elsewhere in Arizona, mostly teens and young adults.
Our norm is very similar to what you're seeing statewide and in the valley areas as well. We've had users as young as 14 years old.
Some say kids are using drugs so young because there is nothing else to do in town.
Right now, the only thing we got for young people in town is the 2 parks, and most of the heroin use is going on at the parks.
As part of the solution, the community has since come together with 22 professional and volunteer organizations.
The school system at all levels, behavioral services that provides clinical help to addictive individuals. We've brought together religious organizations.
While the mayor says there are after-school activities available, others say more needs to be done for the Payson youth.
The kids out here, they need help. They need someone to, they need something to put their time and effort into other than going out and getting high.
The town of Payson will hold another town meeting slated for mid-April to bring in additional resources, provide more education, and help those in need. Live in the Cronkite Broadcast Center, Lauren Hanley, Cronkite News.
Right now, there are a few official programs to educate young people about the harmful effects of drugs like heroin. Cronkite News reporter Mark Mangura talked with a former addict and agencies hoping for a change.
Heroin abuse and the number of overdoses has been on the rise in Arizona ever since 2009. But the problem hasn't gotten a lot of exposure since programs like DARE have been cut out of schools.
Addiction is a problem.
As a former addict, Danny knows the struggle of being hooked on heroin.
Health was deteriorating. I didn't want to get up in the morning. I thought, what's the point, really? I knew that I would have to go out and look for drugs.
He wonders if his life would be different with earlier drug education and intervention in the classroom.
There wasn't anything, no education programs besides DARE, which I had in 5th grade, and frankly, I couldn't tell you a single thing about DARE.
Surprise Police Chief Michael Frazier says that over the years, a series of budget cuts has phased the police-run drug education program out of most Arizona schools.
I will say it wasn't a perfect program, and the reason is this. When you hit, like a couple of classes in 5th grade to prime them, that's one time. Surveys were showing that it wasn't effective long term.
But the lack of knowledge about heroin hasn't helped the fight against abuse.
I knew nothing about heroin. I knew what black tar heroin was. I didn't know what it looked like, what it really did to you.
The Arizona Criminal Justice Commission just awarded more than $600,000 in abuse prevention grants to criminal justice agencies and other nonprofits. Chief Frazier says it's a win in a long fight ahead.
If you can keep a person off of illegal drugs to the age of 19, their chance of ever using illegal drugs is less than 1%.
And Danny agrees that this new funding can offer the resources to help put kids on a better path.
Someone that can go talk to classrooms, whether it be a drug counselor, a former user, a convict, someone that can expose the truths and, what they went through.
The grant money will go into effect for programs starting on Wednesday. Almost a third of the money will go to buying more drug testing kits so agencies can test more often, hopefully catching drug abusers more consistently to get them the help they need. Live in the broadcast center, Mark Mangura, Cronkite News.
For months now, Cronkite News has been taking an in-depth look at the heroin crisis facing Arizona. Tonight, a story of hope for those on the road to recovery. Reporter Ryan Hill takes us inside a local center that offers former addicts a second chance.
As the sun rises over downtown Phoenix, for some it is not just the start of a new day, but a better life.
I have a future here.
Arizona has a problem that it is looking to cure. Thousands of the state's young adults are hooked on heroin. The Changing Lives Center in downtown Phoenix is looking to help the women of the valley break the hold of addiction.
I remember every day thinking, what would life be like if I didn't need heroin?
It wasn't even just the drugs. I was very addicted to the casino also.
After battling her previous drug use and troubles with the law, Dara Torres came back to Changing Lives for a second time. Now working in the Changing Lives daycare, it is not just a second chance for her, but her children.
Even though I didn't want to, I knew in my mind this is where I had to go. I had to come here to get my kids back so I could try to figure out how to take care of them again and just bring me back from that broken person that I was, bring back the person I used to be.
It's not only mothers that Changing Lives is saving. Many young women like Kristen Johnson are also getting a second chance. A sweet chance.
All the girls working in here were clients at the Changing Lives Center.
The Changing Lives Center has not only allowed Johnson to be clean, but to find a new purpose through baking with Mission Cookies.
There was a time when I was a heroin addict and a meth addict, and so this place has pretty much changed our lives completely. It's amazing to be a part of this, and to know that there's an actual purpose for my life, and I believe this is the beginning of it.
Just as she is discovering her new path, Johnson is helping those who have walked along similar lines.
They're going through hard times too, and I've already been through what they're going through. We're all like sisters, and we support each other, and so they keep me coming back every day.
Johnson is hoping that Mission Cookies can be a way for others to get jobs after their completion of the Changing Lives program. For Torres, Changing Lives seems to have let women put aside their past and only look towards the future.
I think it means having a good life from here on out, just going down the right path, being able to get a career going for myself so that I could be just able to take care of these kids the way they deserve to be. I'm never going to drag them down that path again.
In Phoenix, Ryan Hill, Cronkite News.
Cronkite News is committed to tracking heroin's hold on Arizona. We released the documentary Hooked in January with hope that it would bring light to this very real problem. Cronkite News reporter Sydney Schumann spoke with several drug rehabilitation centers about the effect this documentary has had on the community.
I spoke with 2 rehab centers that both credit the documentary for causing people to come in and seek treatment for their drug addictions. Since the documentary's release in January, Jim Kreitler of the Calvary Addiction Recovery Center says they have seen a 10% increase in admissions.
I certainly couldn't attribute all of that to the documentary, But obviously, anything that generates more talk about addiction and treatment, it helps people.
He also says they initially had several people that were direct referrals after they or a loved one called the call center that was set up at ASU while the documentary was being aired. Chance Love as well says the River Source, which is a recovery center, had a lot of people come in mentioning the documentary.
It did definitely influence some patients with choosing to come in for treatment. It brought their fears or concerns kind of to surface. So people were going online and searching to find out more about treatment.
Calvary Center required patients and encouraged staff to watch the documentary as it aired. Love says it had an impact not just on the addicts themselves.
The parents, the friends that know friends that need help or treatment, and it just made it quite clear and concise about how big this problem really is.
Certainly it'd be a lot harder now to find somebody that didn't realize that heroin addiction is a problem in Arizona.
The CDC says heroin overdose deaths are up across the country and here in Arizona.
A few weeks ago, the town of Payson held a town council meeting to address the issue of heroin in their community. This week, they met again, this time to bring community resources to those in need. I went to the town hall meeting this week where I heard stories of struggle, stories of hope, and unanimous urging for education and support.
It's a point many heroin addicts reach.
And a common feeling is, I'm sick and tired of being sick and tired. You know what, here I am again. I'm finding this all over again.
And many times the family suffers with their addicted loved one.
This is a family disease designed to destroy one of the greatest gifts God has to give us, and that's our families.
Because they don't know how to help.
Our 5th graders and 6th graders have more knowledge than we do as parents about drugs and addiction.
This town meeting gave many Payson families a starting point, connecting them with a panel of health service members to educate and provide help.
If you have a question that's recovery-based and you need an answer, call us. If you found something in your house, you're not sure what it is, call us. If you need help, call us.
Both health professionals and recovering addicts stressed nothing is more important than family support.
It's painful to try to help these folks because it just beats you to death. But you gotta be patient, you gotta be tolerant, and you gotta be loving, and you gotta be willing to take them back and do it again.
The first step is reaching out.
Seek help, start talking to other people. Everyone knows someone. As long as you open up your mouth and you ask, I can promise you your answers are going to come and you can live a much better, healthier, new way of living and be a productive member of society.
Cronkite News is renewing a commitment to track the recovery of the heroin addicts featured in our documentary investigation, Hooked, Tracking Heroin's Hold on Arizona. Tonight, we revisit Dara on her path to sobriety.
You think you can move away from it, it's going to follow you no matter how far away you go. You can't run from it because it's something inside you that you need to get right. And you need to get help to get over the heroin because it's just so powerful. I have a relationship with my family again, which is something I didn't think would happen. And I love myself today, and that's something I didn't even really do before I started using heroin. I've never really been okay with me. And throughout this process, I have learned how to be okay with me. Today I'm married, which is somewhere that I never wanted to be or thought I could be. I have a 1-year-old right now and I'm 4 months pregnant, and it's amazing. My husband's in recovery too, and it's awesome. Almost 4 years later, I hardly ever think about heroin unless it's me looking at somebody who's using and being like, God, I'm so happy I'm not there. It's just like relief. It's not like, no part of me is like, oh, I want to go get loaded. It's seeing people who are obviously high or doing a drug deal or are relapsing or in jail, and it's just like, just thank God that I don't have to live that way anymore. I'm a survivor of it now. I saw myself as a victim of heroin, but no, it's something that you move past, and it's just part of my story, made me who I am today.
Every night when I was doing
the last of my dope or whatever to go to bed, I started to really just hope that I didn't wake up. Sober, I mean, whatever way you cut it, it's miserable. It sucks. It doesn't feel good, it's not fun. But the longer that I stay sober, now it's not. Now I don't have to worry on a day-to-day about, am I gonna get high, or is this gonna happen, or is this gonna end? Because I do certain things on a daily basis that ensures that I stay sober and that I continue to have the life that I have now. And now it's more about progressing in my job and making sure that my son's taken care of, and building back relationships with family, and just moving on with my life. Because 3.5 years ago, I didn't think that having a life was possible. It wasn't until my family completely cut me off and gave me really no leeway and no help. I mean, I was homeless. They wouldn't give me money, they wouldn't give me pretty much anything, any assistance. If I called, they wouldn't answer the phone, and that's what needed to happen for me to be able to start to help myself.
I would steal from my mom from an early age, even before heroin, and that's all I cared about. I didn't think about anything other than drugs. It changes who you are as a person. There's a different person inhabiting your body. The addict, it's not you. It's not who you were born to be. It's not, who your family raised you to be. It's not you. It's somebody else, calling the shots. I think it'll get easier, man, but it'll never go away. And you're just one bad decision away from relapsing at any given time, whether it's you're doing so good in life that you think, oh, I'll just get high because I'm bored, you want to have fun or something, that's why it's good to stay busy, or something bad happens. Well, I no longer want to die. I have a desire to live and live abundantly, and be successful. So that's a huge change in itself. I mean, I'm not ashamed of my past. I'm actually, if this is it, if I make it through this, then it's something to be proud of. In my opinion, I've made it through something rough that most people will never even understand, realize, or experience, which is good. I wish this on nobody, but the fact that I have gone through it at such a young age and come out of it, and there's not many that do.
The Federal Drug Enforcement Administration reported last month that heroin overdoses are increasing at a far faster rate than those associated with other illicit drugs, a pattern likely to continue because heroin is relatively cheap, easy to get, and highly addictive.
He was just full of energy all the time. It kept us on our toes. He pushed things to the limit all the time. He had a presence about him, and people were drawn to him. And that's why he had so many friends.
David Richter was supposed to leave for drug rehab on the 17th of September. Instead, just one day before he was set to get help, he was found dead in his apartment after overdosing on heroin. He was 23.
The drug is more powerful than the person. People don't understand that with heroin, how addictive and strong it is.
David had relapsed 13 times and been treated in multiple rehab centers.
I learned to detach myself away from the emotional part, but every time he did relapse, it was hard because I always had that fear that this would happen, that, I would get this phone call that he didn't make it this time.
Mary and her ex-husband Joe repeatedly tried to reach their son the day he died.
He would always get back to me within 5 or 10 minutes. I'm sleeping, I'm working out, I'm doing this, and he never did. And, and that's when I knew something was up.
His roommate, Paul Langford, also a recovering addict, found David dead.
And I got up in the morning, and when I was leaving to go to work, on this table, there was a needle. And so I just went, I just left it, I went to work. And about 9 o'clock, 9:30, I started calling him every 20 minutes.
He decided to go back home and check on him.
And so I walked up the rest of the room and I looked to the left and laying halfway out the bathroom door when David was there on his back.
Corinne Fort, his girlfriend, says he was shooting up the night before.
I think I was somewhat frustrated because he'd just been up all night, and it was just a hard thing to see. It was a hard thing to see him like that. It hurt my heart to see him like that. And but I know I kissed him goodbye, and I left for work. I'm gonna miss him every day.
Paul says he and David were best friends, going to concerts and doing anything to live a sober life.
I've never had a friendship like that with anyone. I've never been as close to anyone in my life as I was with David.
Paul had encouraged David to go back to rehab.
It's one of the hardest things I've ever had to go through.
Corinne and David met through mutual friends at a Heroin Anonymous retreat.
He would always unintentionally do things that just made me happy.
He left notes on their bedroom wall and on the kitchen chalkboard.
He wrote this for me the Monday before he passed.
He would say, "I'm not afraid of death, but you know, I would never let it go that far. I'm not that stupid," but of course he didn't have any control over that, right?
Clips from this video, provided by his mother, chronicle David's life, one of hundreds of lives in Arizona lost to heroin.
It's something unpredictable, but in the end is right. I hope you had the time of your life.
Thank you for joining us for this special edition of Cronkite News. For more multimedia coverage on the impact of heroin, how families and law enforcement agents are coping, a look at the data on overdoses, and to watch the full investigation, go to hookedaz.cronkitenewsonline.com.